Today we will start with another interest learning episode of Forensic Pharmacology Part 1. This module is about the classification of drugs of abuse. It is divided in 6 different modules. Modules 1, Introduction. Module 2, Classification of drugs of abuse. Module 3, the assessment of drugs of abuse harm. Module 4, Drug-Target Interaction. Module 5, Action of different classes of drugs. And finally, Module 6, Conclusions. A drug of abuse is a legal or illegal pharmacologically active substance which have and presents a psychotropic effect on central nervous system with an action on the brain. Since it is not medically indicated, it is just used for a reward action in central nervous system to have feelings of stimulation, hallucination, euphoria, good sensation. All these feelings comes from a stimulation of drugs of abuse in the mesolimbic part of the central nervous system, linked to ventral tegmental area, nucleus accumbens, or nucleus ceruleus, where all the drugs of abuse can perform their actions. When we speak about drugs of abuse, we speak about addiction, dependence. When for the first time we use a drug of abuse, we stimulate our reward part of the brain. So we start with the use, but then a use of a psychotropic substance in reality is a misuse because it is not medically indicated. And we arrive to abuse this substance. So we start with an addiction. Addiction is identified by some parameters. For example, the tolerance to a certain substance. This means that with the passing of the time, we have to consume more substance to have the same effects on the brain. Then we have also a physical dependence. This means that we need the substance to feel good. Then we have the sensation of craving. We crave for the substance. We desire the substance. We cannot stay without consuming. Then also the sensitization. This means that when an individual passes some time without the substance, then reusing the substance can create paradoxical effects, very high effects that in case of some drugs is called overdose. And finally, the relapse. All the times that an individual tries to abandon the use, he can enter in a relapse and restarting the habit. We found a proper classification of drugs of abuse in the Diagnostic and Statistical Manual for Mental Disorder, usually called the DSM. Now we are at the edition number 5, but in the edition number 4 we could find a correct classification of drugs of abuse in 8 different classes. Class number 1, nicotine. Class number 2, alcohol, benzodiazepine and sedants. Number 3, opioids. Number 4, cocaine and amphetamines. Number 5, caffeine. Number 6, cannabis. Number 7, hallucinogens. Number 8, anabolic steroids. Because yes, also steroids can be considered drugs of abuse. In this edition of the manual, we don't speak anymore about drug addiction or drug dependence. We speak about substance disorder, because each substance creates a different disorder. Which is a disorder created by a substance of abuse? It is a condition in which the use of a substance leads to a clinically significant impairment or distress. There is an interesting diagram made by David Nutt, a British pharmacologist, who designed a scheme to define the physical harm and the dependence created by the different drugs of abuse. On the x-axis, we can see the physical harms, while on the y-axis, we can see dependence. At the very left of the diagram, we will find heroin, which is the substance which created the highest physical harm and the highest dependence. Heroin is followed by cocaine. And surprisingly, at the third point, we find nicotine, the constituent of tobacco. After nicotine, we find alcohol, and just in the medium part of the diagram, we found cannabis, amphetamines, and other substances. On the very right part, we will find the steroids and also cat and other amphetamines. So the different substances, some of them can cause death directly, such as heroin or cocaine. Some other, like cannabis, does not, but usually a drug abuser does not consume only one drug. He consumes more than one drug. So we define a polydrug use, and in many cases, the cause of death is the polydrug use. And so the physical harms and the problems caused by the interaction or synergic action of different drugs. I will explain the action of different drugs of abuse on the brain. There are some drugs which present specific receptors on the brain. So when the drug links to this receptor, its action is created, and the link with this receptor created a transformation in brain cells, which can be a stimulation or a sedation, depending on the neurotransmitter involved in this action. For example, some drugs of abuse act in the brain because they have receptors on different neurotransmitters. For example, opiates like heroin, morphine, codeine, well, they have a series of receptors, mu, K, sigma, in the GABAergic transmission, in the transmission of gamma-aminobutyric amide. This is an inhibitory transmission. When an opioid or an opiate, and for opioids we intend synthetic opiates such as fentanyl, methadone, buprenorphine, when they enter the brain and pass the hematoencephalic barrier, they link to this receptor, and the link with this receptor starts the entrance of some ions in the brain cells and the liberation of neurotransmitters, in this case, inhibitory neurotransmitters. The same is for cannabinoids. cannabinoids presents two different receptors, CB1 and CB2. CB1 receptors are mainly located in brain, while CB2 receptors are located in the rest of the body. Also in this case, when a cannabinoid, even if natural, such as delta-9 tetrahydrocannabinol, or synthetic, like all the synthetic cannabinoids, linked to this receptor, an inhibitory action is started inside the brain cell. In the GABAergic transmission, we found also receptors for ethanol or benzodiazepine. Differently, substances such as cocaine or amphetamine do not present receptors on brain cell, so they have an indirect action on neurotransmitters contained in brain synapses. In fact, cocaine and amphetamines and all the amphetamines type substances act as inhibitors of neurotransmitter transporters and also has inhibitors of reuptake of neurotransporters inside inside a synapse. If we consider an intersynaptic space, we have the upper synapses and the lower synapses. The neurotransmitters present in the upper synapses are delivered in the intersynaptic space and they deliver their actions. What substances such as cocaine or amphetamine do is that they inhibit the reuptake, so the reentrance of these neurotransmitters in the upper synapses. And so the neurotransmitters remain for a longer time in the intersynaptic space. Cocaine and amphetamine and methamphetamine act mainly on dopamine synapses, so they liberate a bunch of dopamine in the intersynaptic space, and this neurotransmitter is not reabsorbed. Other amphetamine-type stimulants, such as, for example, MDMA, 3,4-methylene-deoxymethamphetamines, well, this substance stimulates the release of serotonin in the intersynaptic space. The problem is that with the passing of the time, the morphology or the synapses are altered by this continuous enormous release of neurotransmitter and the inhibition of its reuptake. So the morphology is changed, so has the homeostasis of central nervous system cells. Finally, the hallucinogenic substances also act in serotonin neurotransmitters, but they are inhibitors of particles transporter, the so-called 5-HT2A, which created the sensation of hallucination, which are different from the sensation of psychostimulation created by, for example, MDMA. With the different inhibition of different neurotransporter, we will see different actions of the stimulant substances. And with the different link with the receptors, we will also see different actions of the different substances. At the beginning of the use of different drugs of abuse, the effect is always the same. It is a release of dopamine in mesocortical limbic part of the brain. So we have an increase of dopamine, which is perceived as a reward effect and also a relief of distress. So we have two different sensations, the sensation of feeling good, feeling guide, but also the sensation of eliminating a stress situation or stressful sensations. then the action of different class of the drugs will be different. For example, in case of opioids, the link to the receptors mu or K create a sensation of painless, so the disappearance of any type of pain, which is called analgesic action, together with a certain euphoria. This is caused by any drugs of abuse because it is a dopamine release, not only also catecholamine release inside the brain. The sensation of euphoria, little euphoria, is perceived with many drugs, also with ethanol, when the concentration of ethanol is not so much inside the brain. Then, with higher concentration of ethanol, the sedant action on GABAergic transmission is prevailed. In case of cannabinoids, the link with cannabinoids receptors also give a sensation of euphoria, but also of calmness. The subjective feelings are very similar to those of ethanol. And indeed, also with higher concentration of cannabinoids, we have a sedation effect. The subject sleep, such as in case of high concentration of opioids or high concentration of ethanol, because the action is mainly on GABAergic inhibitory receptors. On the other part, when we speak about cocaine or amphetamine, we spoke about a sensation of psychostimulation, entactogenic sensation, which is feeling very good in presence of other persons, feeling high, feeling good, feeling emotional, because we have the release of two different neurotransmitters, dopamine and serotonin, which are responsible of happiness, of love sensation. And so we feel good, we feel stimulated, even if higher concentration of cocaine, but also of amphetamine, leads to a state of agitation. When we exceed with the concentration, we always have a state of agitation, of paranoia and psychosis. These three sensations are the main side effects of the different substances of abuse. And these are sensations in the brain. We have also other physical effects. For example, in case of cocaine, we have a vasoconstriction of peripheral vessels. So we feel this sensation like in the legs or in the hands, and they are swollen and they are red. We have an increase of blood pressure and so problem in cardiovascular system. On the other side, when we use opioid, we have a deepen in the blood pressure, and sometimes we can have a block of the function of the heart. So on a part there is opioids which can stop the function of heart. On the other part we have cocaine which can increase so much the functioning of the heart that it can provoke a stroke, an infarct. This is the same also with methamphetamine. Regarding amphetamines, the problem is hyperthermia. This substance, also taken for the first time, created an hyperthermia 42 degrees centigrade, 43 degrees centigrade, without any sweating. So the cause of death is this. Or the cause of death can also be a cerebral edema, especially in the females. We have to remember that amphetamines are the substances which can cause death at the first absorption, even if at normal doses. Because of this, and because also a paralysis of the liver, which has no clear explanation, but which occurs in many cases. It is called the hepatic infarction, and the individual die. So, continuing speaking about the side effects of different drugs of abuse, we have to say that in case of opioids, the major risk is the risk of respiratory depression, which can cause death. But we have to remember also that in case of opioids, but also in case of other drugs of abuse, the major risk is the risk of overdose. This risk can occur when, for example, an individual buys an illegal drug from a source different to the normal one. So the percentage of the drug in the illegal preparation can be different from the concentration usually consumed by individual. And if it is more, the problem is that the effects are magnified, and sometimes the effects on cardiovascular system, for example in case of cocaine or amphetamine, can cause a stroke. In case of opioid, the risk is the suppression of respiration, causing a death. As I said before, in case of amphetamines, the cerebral edema can be a cause of death. The chronic effects of these substances are perceived in the brain because the morphology of the brain is modified, and so the individual loses the homeostasis of the brain, paranoia, psychosis, anxiety. And so this is the craving. The individual cannot live without assuming another time the drugs of abuse. In case of abstinence, we can treat the individual, first of all, to calm this kind of sensations with benzodiazepine. In some cases, we have antidotes for these substances. For example, in case of heroin, we have naloxone for an acute crisis, and then treatment with methadone and buprenorphine for maintenance. But in case of cocaine or amphetamine, we don't have antidotes, and so we try symptomatic treatments to try to save and to calm the individuals. When there is an abstinence for a certain time, we have to remember that an individual who have been using drugs of abuse will remain always a drug consumer who can relapse at any time. So he has to consider these conditions. Usually, the morphological changes in the brain are reversible, but not in case of, for example, methamphetamine. For this substance, irreversible changes are observed. We analyzed a different classification of drugs of abuse. We spoke about the principal and more dangerous drugs of abuse: opiates, heroin, cocaine, amphetamines, cannabinoids. But also the other drugs of abuse are very dangerous. First of all, of nicotine. People do not perceive nicotine as drugs of abuse, but in fact it is. And nicotine also presents the nicotinic receptor in the brain, which affect the acetylcholine transmissions. We also have to take in mind the action of anabolic steroids, which were recently found to act on the brain. Recently, in Europe, we created a network of scientists studying drugs of abuse, which refer to the European Monitoring Centers for Drugs and Drugs of Abuse located in Lisboa. They also have a website with the most updated information regarding not only classical drugs of abuse, but also new psychoactive substances, the substances entering the market in the last years. Thank you.